Hi everybody, we're going to start with the cardiovascular system. This is a two-part system. We'll cover the heart information first and then blood vessels next. This particular video covers heart anatomy and blood flow. If you're following me in the course pack, let's take a look at page 35. Let's start with just a general overview of the function of the cardiovascular system. The heart's function is to pump blood, and the vessel's function is to transport items in the blood. So like I mentioned, we're going to cover heart information first in this chapter. The heart is a fist-sized organ situated nearly in the center of our thoracic cavity. It weighs less than a pound. It is also situated in a snug area between the two lungs called the mediastinum or mediastinum. I'll stick that word on here for you. Now the interesting thing about this word is if you look at it, media means middle, stinum kind of sounds like sternum, and in fact the heart is situated in the middle of the chest underneath the sternum. Looking at this picture, we can see the mediastinum, that is this area here that the heart is situated in. We can also see the apex of the heart, that is this pointed region here that points down towards your left hip. And that is the area where we feel the most intensity for the heart contractions. For that reason, some people mistakenly think that their heart is situated more toward the left side of their thoracic cavity than it really is. This portion up here is known as the base of the heart. That's where all these blood vessels emerge. The base is pointing somewhat towards your right shoulder, but they do emerge off the superior side of the heart. Another view here of the position of the heart in the thoracic cavity. You can see the sternum situated here. You can see the lungs on either side, and right here in this cavity is the heart. The heart is also situated in its own serous membrane. It's in its own pericardial sac, which we'll talk about next. You can see in this picture the heart and lungs are both surrounded by a type of serous membrane. The membrane surrounding the lungs is called the pleura, while the membrane surrounding the heart is called the pericardium. You may recall from Bio 210, the construction of a typical serous membrane involves an inner visceral layer and an outer parietal layer. So in this image, is number 1 the visceral layer or the parietal layer? Number 1 is the visceral layer. Number 2, the outer layer, is the parietal layer. Okay, so the inner visceral layer anchors directly to the heart itself. So the heart organ would be situated in here, and the visceral layer would be anchored to it. In fact, that visceral layer is so tightly anchored to the muscle tissue of the heart that it would be difficult to separate the two. The parietal layer creates a somewhat looser sac for the heart to sit in, and we know from our discussion of serous membranes in Bio 210, there's a type of fluid between the visceral and parietal layers of the heart. This is called serous fluid. And like we talk for other organs, it is there to help reduce friction and to lubricate as the heart beats in the thoracic cavity. So there's an opportunity for a lot of rub as the heart moves against the lungs, as the lungs inflate, and as the heart beats. So this particular fluid is there to help reduce friction and to lubricate around these organs. So let's take a look at this picture. We just talked about the visceral and parietal layers of the pericardium, so let's locate those first. Here you can see the visceral layer of the epicardium, and that is actually anchored to the heart muscle itself. So we call this layer visceral layer of the serous pericardium, or we alternately call it the epicardium. The two names imply the same layer of tissue that's anchored to the underlying cardiac muscle tissue. There's a space here. That pericardial space is home to serous fluid. And this next layer is called the serous pericardium, but it is the parietal layer. And you can see that it is found out here. Okay. Now, anchored to that parietal layer of the pericardium is a layer called the fibrous pericardium. That fibrous pericardium creates a tough outer layer for the heart. So, if you were to think about double-sided gift wrap or a sheet of a magazine or a page of a newspaper, there is print written on both sides. Okay, so that's how the fibrous pericardium and the parietal pericardium work. They are like double-sided gift wrap, or you could think of them as double-sided print on each side of a magazine page or a newspaper or a book page. The outer tougher fibrous pericardium is lined on the inside by that single layer of squamous tissue called serous pericardium. So let's do this. Let's imagine that we were a needle piercing into the heart from the outside to the inside. The layers we would encounter first would be the fibrous pericardium on the outside. Next, we would encounter this parietal layer of the serous pericardium. We would then encounter this pericardial space. That's where the fluid is housed. It's not technically a layer, but the next layer we would encounter is this one here. It's the visceral layer of the serous pericardium, otherwise called the epicardium. It depends on your perspective. If we're talking about the walls of the heart, you would call it epicardium. However, if you're talking about the layers surrounding the heart, we would call it the visceral layer. The next layer that you would encounter as you came into the heart would actually be another heart wall layer. That would be the myocardium, and then the innermost layer would be the endocardium. Okay, so just keep those orders in straight from fibrous to the parietal pericardium to the visceral pericardium. In this image, you can see a portion of the pericardium folded back. That's letter A. Now the question is, what are you looking at in letter A? You're actually looking at the underside of the fibrous pericardium. That is the parietal pericardium that is anchored to it. So you're getting a direct view right there of that parietal pericardium. Underneath, you can see there's a bit of space around here between those two layers, between A and B. In fact, you've got a great view of it down here. What is found in the space between letters A and B? That is serous fluid. Letter B is the visceral pericardium. That is, again, a very thin layer of simple squamous epithelial tissue that anchors itself to the heart muscle beneath. Let's talk for a moment about this condition. You'll notice in the heart chapter there's a lot of conditions that have multiple names. This one, for instance, is called cardiac tamponade, heart plug, or pericardial effusion. In this condition, we see an excess buildup of serous fluid, blood, or pus around the heart, and it happens to build between the visceral and the parietal layers of that serous membrane. Now, the problem is this can put a squeeze on the heart, so as the heart tries to contract and pump blood, there may be a squeezing effect due to this excess fluid gathered around the heart. This condition can come from myocardial rupture, meaning heart muscle rupture from heart attack. It can come from cancer, pericarditis, or cardiac surgery. So in this picture on the right, you can see that syringes may be inserted to extract out that fluid and reduce the pressure of pericardial effusion on the heart. A lot of the symptoms here, you'll notice, have the similar setup of what you would expect for any heart problems, such as heart attack, for instance. Like we always hear, if you have heart pain or heart chest problems, get it checked. Let's now talk about the layers of the heart itself, from superficial to deep. We've already talked about the visceral pericardium being the same exact layer as the epicardium. They just happen to have two separate names. Now our perspective is looking at the heart wall or heart layers itself. So we have a superficial serous membrane called the epicardium. We have a muscular layer called the myocardium, and we have a deep layer called the endocardium. In this picture, you can see the outer epicardium that forms the covering on the outside of the heart. The muscular myocardium is easiest to see in the ventricles. It is thicker there. And the endocardium is, again, squamous tissue that forms the innermost lining of the heart. Let's talk about the myocardium for just a moment. Take you back to Bio 210. The myocardium is made up of cardiac muscle tissue. So thinking back, what are some features that make this particular tissue unique and different from other muscle tissue types? One thing you'll notice is this particular tissue branches. You can see a branch right there. Another unique feature is the fact that this tissue has intercalated discs, which are gap junctions that allow for nerve impulses and ions to travel immediately from one cell to the next. We want the heart to contract as a coordinated unit, not as a bowl full of jelly. So having these intercalated discs and branching cells allows for those heart muscles to coordinate and produce a unified kind of contraction, atria first, ventricles second. Let's also talk about the third bullet point here. Muscle cells in the cardiac area in the heart are amitotic at maturity. You may notice the word mitosis hidden in there. The prefix A means without or negative. So amitotic means without mitosis. In other words, if you damage heart muscle tissue, you replace it with scar tissue. And you may recall that scar tissue is mostly collagen fibers. Collagen fibers do not contract when they're stimulated by nerves. So unfortunately, if a person has heart muscle damage due to a heart attack, that scar tissue means the heart no longer works as it once did. If there was a way for us to get new muscle tissue cells to replace damaged old ones, then we may have a way to repair heart muscle damage. But you never hear of cancer in the muscle tissue of the heart, and this is why those muscle cells are amitotic. They do not divide at maturity. The last feature here is a very interesting feature, and that's the fact that the muscle cells on the heart contract independently of nervous system control. So left by itself, the heart, given enough nourishment, can beat on its own. This may sound like a story from Frankenstein, but that is in fact what we're going to talk about in just a few moments. All right, so once again, the walls of the heart, let's start here with epicardium. That's the most superficial layer of the walls of the heart. Keep in mind, it is the same as your visceral pericardium. Next, we have the myocardium, and then finally the endocardium. Just a few terms here for us to look at. Pericarditis is heart inflammation. This can come from a bacterial infection from the heart itself, or even can come from the nearby lungs. When those layers become inflamed that surround the heart, instead of gliding and sliding past one another as to reduce friction, those layers rub past one another. So that rubbing every time the heart beats can create heart pain. So if we can get rid of the underlying cause, whether it's an infection or simple inflammation, then we can cure this condition of causing heart pain. Endocarditis can come from inflammation or infection inside the heart. This comes here in this picture from a case of streptococcus. You may have heard of strep throat before. That bacterium can get into your bloodstream and cause all sorts of damage, including in the heart and in the kidneys. So in this next picture, you can actually see inflammation on those chordae tendineae, which form the heart strings for those heart valves. So certainly a very painful problem there that we would want to get rid of. If it indeed is caused by streptococcus bacteria, then we would treat that with antibiotics. Let's talk about the heart and its 4 chambers and 4 valves for just a moment. You'll need to follow me over to page 36 for this information. The heart has 2 superior atria. You can see them right here. This is the right atrium. And over here is your left atrium. Of course, we're looking at this from the perspective of anatomical position. You'll notice the walls of each atrium are thin. That's because the muscle tissue is mostly found down here in the ventricles. In the inferior side of the heart, we have an inferior right ventricle. And of course, over here, we call this ventricle the left ventricle. Let me caution you about the word atrium. Atrium means a singular chamber. They are the superior chambers of the heart. If we're talking about them together in plural form, we call them atria. Let's talk about the right atrium for just a moment. The right atrium receives blood from 3 veins. SVC, which is superior vena cava, IVC, which is inferior vena cava, and there's one on the back side of the heart here that you can't really see. It has an opening here near that fossa ovalis, and it's called the coronary sinus. So coronary sinus also returns blood back into the heart. So 3 veins return blood. SVC from the superior side of the heart, IVC brings up blood from the inferior side, coronary sinus brings blood from coronary circulation. This deoxygenated blood is then returned to your right atrium. The left atrium receives blood from pulmonary veins. There's 4 of them. There's 2 over here and 2 over here. That gives us a total of 4 pulmonary veins, and they return oxygenated blood to the left atrium of the heart. So this is an unusual case. Normally, veins carry deoxygenated blood, but here's an exception. This is one place that these veins carry oxygenated blood. So should these veins be colored red or blue on our models? They should appear red. So if you think of this poem, arteries are red, veins are blue. In the heart, there's an exception of 2. It's the pulmonary veins and the pulmonary arteries, which are right here, that are reversed in color. Let's talk about your ventricles for just a moment. The 2 inferior ventricles are the discharging chambers of the heart. They have more muscle tissue that allows them to contract and pump with more force or pressure. The right ventricle, you'll notice, has a little less muscle tissue than the left ventricle, and that has to do with where the blood's being sent. Where does the right ventricle send blood? If you follow from the right ventricle, it goes through this pulmonary trunk and out to the lungs. Because we're only sending blood next door to the lungs, we don't need as great a pressure here. So that's why there's less muscle tissue in the walls of the ventricle on the right side. On the left side, that left ventricle has much more muscle tissue, and that's because if we follow where that blood goes, it exits through the aorta. So we do need more muscle tissue here because the pressure or force created behind the contraction is actually around 5 times the pressure created by the right ventricle. So you'll notice this anatomical difference here created between the right and left side of the heart. The left ventricle is the discharging chamber that sends blood out for systemic circulation. Now, there is a wall that divides the heart in half. You can easily see this interventricular septum down here. I'm just going to call it IS because we don't have a lot of room. There is an interatrial septum, but it's hidden behind all of these vessels up top. So if we were just continue that up, that would also be a wall between the 2 atria. All right, so on the anterior side of the heart, if we were to actually look at it from the outside, you would also see some grooves called coronary sulcus on the anterior and posterior side, but we're looking interiorly right now, so we don't actually see them from this vantage point. So that looks like it's covered page 36 for you. Let's now talk about the valves found on page 37. There's also 4 valves of the heart. There are 2 atrioventricular valves and 2 semilunar valves. The atrioventricular valves are these here. They're called the tricuspid valve and the bicuspid or mitral valve on the left side. So these are atrioventricular valves, called such because they are situated where? Between the atrium and the ventricle. Okay, so we have 2 of these valves. They are anchored by heartstrings known as chordae tendineae. So you can see right here some of these heartstrings. And they are anchored to papillary muscles, which look like little fingertip extensions in the ventricles. So imagine this. Imagine when the ventricles contract. Those papillary muscles also contract. When the papillary muscles contract, they pull down on those chordae tendineae. And when we pull down on those chordae tendineae, we slam shut those tricuspid and bicuspid valves. In other words, these valves are anchored by heartstrings into the ventricles. Ventricular contraction will cause them to slam shut and close. Now, they are such named because of the number of cusps they have. The tricuspid valve has 3. You can see them right there. And the bicuspid valve or mitral valve has only 2. I'll tell you an easy way to remember these. Tricuspid has an R for the right side, TRI, tricuspid on the right side. Bicuspid, of course, is on the left side. It only has 2 flaps. Another way to keep this straight is some people say you must try, TRI, before you bi. And of course, if blood flows through, it's going to come through the tricuspid valve before it heads through the bicuspid valve. You will want to know that mitral and bicuspid are the same valve. They're just 2 interchangeable names for that valve situated between left atrium and left ventricle. All right, so we know that the papillary muscles and chordae tendineae will cause these valves to slam shut. So that's when the heart is contracting. What do you think happens to these valves when the heart is relaxed? Well, those valves actually open. So during heart relaxation, called diastole, those heart valves sit open. But during heart contraction, called systole, those heart valves will be slammed shut. Let's now turn our attention to the semilunar valves. They are called the pulmonary semilunar valve, or you can call it pulmonary SLV for short. And then over here we have the aortic valve, or aortic semilunar valve, excuse me, or aortic SLV for short. Now you'll notice that each of these valves guards the base of a large artery. And the pulmonary valve guards the base of the large pulmonary trunk, which takes blood to the lungs. The aortic valve guards the base of, guess what, the aorta, and the aorta takes blood to the body. All right, so when the heart is relaxed, those valves are actually closed. They're like trap doors. The only time they open is when blood forces against them, pushing them open. The force of blood moves past those valves and into the large arteries exiting the heart. After the blood exits through those two large valves, they then slam shut. So keep this in mind. When your heart is relaxed, your AV valves are open, but your semilunar valves are closed. However, during heart contraction, your AV valves are slammed shut, while your semilunar valves are forced open. Okay, so they're generally not open or closed at the same times. We're going to talk about two little exceptions to that as we move through this content. Just another view of those bicuspid and tricuspid valves here. You can see the 3 cusps for that tricuspid valve and 2 for the mitral or bicuspid valve. All right, so let's talk about coronary circulation found on the bottom of page 37. We often forget that the heart itself is an organ and it too needs nourishment of oxygenated blood. So in this image, you're looking at the outside surface of the heart and you're looking at some of the coronary arteries that serve the myocardium. Every time the heart beats, blood is ejected through the aorta, and the intention is for the aorta to transport that blood out to the body. But a little bit of that blood is stolen away by these coronary arteries that serve both the anterior and posterior side of the heart. These coronary arteries carry blood to specific portions of the heart muscle tissue. In fact, you can see over here on the left side of the heart, we have a set of circumflex and left anterior descending arteries that serve that myocardium. The right coronary artery serves the opposite side of the heart on the anterior side. So what do you think happens to the heart muscle tissue if there's a blockage, like say for instance right there? Well, if you're unable to supply oxygenated blood to the rest of the myocardium, that heart muscle may die. And if you survive this, then you may have scar tissue replace that damaged muscle tissue. Which side of the heart do you think is more dangerous to be interrupted with its blood supply, the left side or the right side? Obviously the left side, because that's how we get blood out to the rest of the body, including the brain. When blood is drained back into the heart from coronary circulation, it gathers into a large vessel on the back side of the heart. Great cardiac vein leads into a coronary sinus. This coronary sinus right here will dump blood back into the right atrium. And you are looking at the back side of the right atrium right here. In fact, that is the IVC bringing blood back in and the SVC. Now we finally have a view of our third component, the coronary sinus, which carries deoxygenated blood back into the heart. Now, if I were just looking at the picture, how would I know that this vessel is carrying deoxygenated blood? It's blue. So most of our models show red for oxygenated blood, blue for deoxygenated blood. Of course, you have to remember the exception of 2. Pulmonary arteries and pulmonary veins are reversed. These here are our 4 pulmonary veins, and they in fact carry oxygenated blood to the left atrium. So coronary sinus is just a big vessel. It carries deoxygenated blood from coronary circulation back into the right atrium. Great video here if you would like to take a look at coronary arteries. I can't link to it from within this PowerPoint, but you may copy and paste that and watch it. I did want to talk to you about open heart surgery. It is sometimes called CABG for coronary artery bypass grafting. In this case, we can use a vessel from elsewhere in the body, for instance, a vessel from the leg, from the arm, or even a mammary vessel to bypass over the blocked area. So if we have a blockage in a coronary artery, we just link up with the aorta like the coronary arteries do. We bypass that blocked area and we make a new connection. So interesting here that we have a way to bypass those damaged vessels and now resupply oxygenated blood to that particular tissue. Does this reverse damage done to the muscle tissue? No, unfortunately not. It just continues to provide an oxygenated supply of blood to the tissue that was once damaged or starved of that tissue. So why use our own vessels for this? Why not use, say, pig vessels or other kinds of vessels? Well, we have less of an opportunity or chance for rejecting these vessels if they come from our own bodies. All right, so we're going to turn on over to page 38 for just a moment. And we're going to talk about blood flow. And this is something you're going to have to learn for both lecture and lab, and we will reference back to this multiple times throughout the course. I encourage you to use a picture, somewhat like you see on page 38, and use an image to help you walk through this blood flow pathway. Keep in mind there's actually two patterns here of circulation. We have a systemic circulation that involves the blood flow from the heart to the body and back. And we also have a pulmonary blood flow or circulation that takes blood from the heart to the lungs and back. So just keep in mind that systemic means body, while pulmonary means lungs. We could start anywhere on this pathway. I just happen to have started you with SVC, IVC, and coronary sinus. But on your test, you'll want to be comfortable picking any place as a starting point and returning back to that as your end point. So let's start with SVC, IVC, and coronary sinus. From there, blood travels to the right atrium, through the tricuspid valve, into the right ventricle, up through the pulmonary semilunar valve, into the pulmonary trunk, right here, through pulmonary arteries. Pulmonary arteries take us to smaller pulmonary arterioles, to pulmonary capillaries. Of course, we're heading to the lungs for the gas exchange. We drop off CO2 and we pick up oxygen. And now we return back through pulmonary venules, pulmonary veins, and of course these pulmonary veins bring oxygenated blood back to the heart. We now return to the left atrium of the heart, having finished our pulmonary circuit. We pass through the mitral or bicuspid valve, into the left ventricle. Now we're going to be ejected from the heart and travel on a systemic pathway, exiting through aortic semilunar valve. We travel up through the ascending aorta, descending aorta. There's a thoracic aorta. There's even an abdominal aorta. And eventually we travel out to our body's arteries, arterioles, capillaries, where we drop off oxygen and pick up CO2. We return back to the heart through venules, veins, and there we join through either SVC or superior vena cava or IVC, inferior vena cava. We also have blood returning back to the right atrium from one third location, and that is coronary sinus. So now we've reached back to our starting point with the right atrium. I would encourage you, like I mentioned, to start anywhere in this pathway and reach back to the starting point. So for instance, you might say, I'm going to start with the pulmonary trunk, take it through the entire circulation process, and then make that your ending point as well. I really think if you use a picture to learn this, that you'll have a much easier time than just staring at the words on this page, because that makes it a little less entertaining to have no picture to watch as you go through this.